Welcome, I'm Emily Bushnell, nursing instructor at Vincennes University. In this video, we'll walk through the procedure to safely and efficiently insert a Foley catheter. The first step to doing any nursing skill is to identify the client using two client identifiers, such as the name and date of birth. You will also need to explain to the client what procedure is going to be performed. Raise the bed to a comfortable working height for yourself. Position the client in a supine position with the legs straight and slightly apart and drape them for privacy and modesty. Once the client is verified and positioned, don clean gloves and perform perineal care. This ensures that the area is clean prior to the sterile procedure. Remove and discard gloves and perform hand hygiene. Now, organize your sterile field and workspace. You cannot turn your back on your sterile field, so make sure you can see all aspects at all times. Make sure you remove all watches and jewelry. Hair is pulled out of the way. You do not want to contaminate your sterile field. Next, place a red biohazard bag at the bottom of the bed. Begin opening your sterile catheter kit in the bed between the client's legs. The first flap must be opened away from you to ensure you do not contaminate your sterile field by reaching across. You have a 1-inch border on your catheter kit that is considered not sterile. At this point, don sterile gloves. Glove packages also have the 1-inch border. As you glove, lift your sterile glove high off the sterile field to ensure you do not break sterility. Keep sterile gloves above your waist. Place the blue drape from the catheter kit shiny side down on the bed. This drape will keep the bed dry and lengthen your sterile field. It is important to fold the drape over your hands to place it and keep it sterile. Next, you will place your fenestrated drape over the penis, making sure not to drag the drape on any unsterile parts of the bed. Now, you can organize the inside of the kit. Open the swab sticks. Open the lubricant. Squirt the lubricant into the tray. And place the catheter inside of it. When placing trash into the red biohazard bag, bring it towards you first so you are not taking it over your sterile field. Hook the syringe to the balloon port of the catheter. Once your kit is organized, you will commit your non-dominant hand to become not sterile. Now, grasp the penis and begin to clean it with your swab sticks. Hold the penis gently but firmly at a 90-degree angle to the body with light tension. Starting at the meatus, clean in one circular motion and discard the swab stick. Repeat with the remaining 2 swab sticks moving in a downward direction. With your dominant hand, you will now insert the catheter. Ask the client to take deep breaths while inserting. For a male client, you will advance the catheter to the bifurcation. Once the catheter is inserted and you get urine return, stabilize the catheter with the non-dominant hand, and with the dominant hand, inflate the catheter balloon. Clean the client's genital area and remove and discard supplies. Then clean the work area and hang the catheter bag on an immovable part of the bed below the level of the bladder and secure the catheter using a stat lock or a piece of tape. Return the client to a comfortable position with the call light in reach. Be sure to document the catheter size, amount of urine obtained, color and clarity, and amount of sterile water inflated in the balloon. You've now seen the process for inserting a catheter. To learn more, look for our other videos on medical techniques and procedures.